From the Toronto Star, I'm Adrian Cheung, and this matters. What does it take to control COVID-19? Well, there isn't just one answer to that question, but experts point to something that does help: paid sick leave. "58% of workers in Canada don't have paid sick leave. For low-wage, often essential workers, that number jumps up to 70%. Many have to choose between going to work sick or not getting paid at all. Public health officials like Eileen de Villa are calling for a sick pay program.
Whether we're talking about things like sick leave provisions and income supports so that people can refrain from attending work when they're sick or symptomatic. These are the kinds of things that I know will make a difference. We've seen them work before. We've seen them work in other jurisdictions, and I know that they will work again.
Ontario's government has not created a paid sick leave program, pointing instead to the federal sick pay benefits. But the Ford government is facing public pressure to do something ahead of the budget release later in March. On This Matters, we're talking to Robert Benzie, the Toronto Star's Queen's Park bureau chief. He takes us inside the months-long political fight over paid sick leave, the trouble with the federal program, and what might be coming down the pipeline soon. Rob, thanks for joining us. Great to have you back on the podcast.
Great to be here, Adrian.
So let's start off with some context on the issue of paid sick leave in Ontario. Public health officials and city mayors like John Tory have been in favor of it through much of the pandemic. What is the Ontario government's stance on a paid sick leave program?
Well, the Ontario government has been a bit confusing on this one, Adrian, because Premier Doug Ford, when he was elected in 2018, one of the things that he did was he canceled the 2 days of paid sick leave that the Liberal government had imposed on businesses before that election. And he also canceled an increase in the minimum wage, which was supposed to go up from $14 to $15 over the course of 2 years. And Mr. Ford canceled those. Now, he won the election. He said he was going to do those things, and he did. Now, that was obviously before the pandemic. And the thing with paid sick leave is we know that people who don't have the kinds of jobs where you're allowed to be sick from work and that they have to go in, if they don't go in, they don't get paid. And we know that some people who are sick are going into work. And because of that, the federal government created a program called the Canada Recovery Sickness Benefit, which was 2 weeks of paid sick leave, $500 a week. But it's a very cumbersome program. It's a $1.1 billion program across the country. No one was really tapping into it. So the federal government actually doubled it recently to 4 weeks of paid sick leave with some lobbying from Ontario's Labour Minister, Monty McNaughton. But it still only pays $500 a week. It's actually $450 because they take off $50 a week for taxes, and you have to apply each time that you need it. And it's just not as seamless a program as a lot of provincial programs are. I mean, the federal government is notorious for not being able to deliver programs to people as effectively as municipal and provincial governments. And that's always been the case. This is not to cast aspersions on this particular federal government. It's always been that way. And I don't know why that is. That's something for another podcast. But because of that, the Ontario government has been promoting this federal program, this Canada Recovery Sickness Benefit. And they talk about it every day in the legislature, but they still take a lot of heat because the New Democrats, the Liberals, and the Greens in opposition all say that it is inadequate, that this program is hard to navigate, hard to apply for, and doesn't pay you enough. So now there is a lot of pressure on Premier Doug Ford's government to do something.
Right, because the Premier has previously said, his words, there's no reason for Ontario to get involved in this. He's commonly cited that federal program, which you just talked about, as, well, that's already taking care of this situation. But again, there's criticism about how that actually works.
Well, exactly. And he's used the unfortunate phrase of double dipping. I don't think he meant to say it quite as perhaps objectionably as that. But what he said was, we don't want people double dipping.
Out of the $1.1 billion the federal government has, they've only spent right across the entire country $319 million. So why would we go double dip into the pockets of the taxpayers when there's a program already in place?
Getting $500 from the federal government and maybe $500 from the provincial government when they're sick. I don't think that's the intent of these types of programs. And I mean, I think it was a clumsy way for him to frame it. I think, however, there is room for the provincial government to bolster the federal government. And later this month, Peter Bethlenfalvy, the finance minister, is going to table a provincial budget. And we don't know yet what's in that budget, but there is a lot of pressure from stakeholders like mayors and others, business groups and so on, to bolster this program. Even the Ontario Chamber of Commerce, which represents 60,000 members, businesses and local chambers of commerce across the province, has said that the province and the feds have to step in on this because businesses themselves cannot afford this program. Now, I've talked to Mr. Ford and others around him about this, and they are concerned that businesses have been so badly hit by this pandemic and thousands of them have already closed that they don't know if they can put another burden on business. Because remember, paid sick leave isn't necessarily a government program. It actually would be paid by the employers themselves, except in the instance of the federal program, which is paid for by Ottawa. So there is pressure on the government to do something. The Chief Medical Officer of Health, Dr. David Williams, has said that paid sick leave is a good way to keep the spread of COVID-19 from rising. It's interesting politically because Mayor John Tory in Toronto and Mayor Patrick Brown in Brampton are both former progressive conservative leaders. And they have said that Queen's Park needs to do something as well.
There has been no response from anybody about this when we know from our public health people and we know from the facts and figures, this is a real source of fear and concern out there.
So there's a lot of pressure on the Ford government.
We'll be right back. This issue of paid sick leave, as you mentioned, was sort of a thorny issue even before the pandemic. You mentioned that the Ford government got rid of those 2 paid sick leave days. And this conversation has extended for months now. There have been calls for the province to step in and do something. This is not a conversation that started at the beginning of 2021. It's been going on for months, right? So politically for them, is it almost a non-starter for this provincial government?
Yeah, I mean, Adrian, you could argue that they've already taken the political damage. The only thing is, political optics aside, this is something that we know does stop the spread of COVID-19. And workplace spread has been an issue, whether it's at an Amazon warehouse or a post office or a meat packing plant. We know that people who go to work are getting COVID-19 in certain types of workplaces. And I think that you could look at it ideologically and say, look, we're against this because we're supposedly pro-business, even though the Canadian Federation of Independent Business says that this government has been the worst in Canada for dealing with businesses, ironically. But I think politically, they're already paying a price, so they may not do anything. That's a point. But I was speaking with some senior government officials this week about a new push that the NDP has on saying that people should get 3 hours of paid leave so that they can go get vaccinated. You know how in provincial law, you get 3 hours off to go vote on election days. So that's an interesting push by the NDP to say, look, we can't have people not even able to leave their workplace to go get vaccinated. I won't be surprised if the Tories act on that. It's going to be trickier for them to do something on paid sick leave because, as I said, they've already paid a political price for it.
So knowing that political cost, then internally, do you think that they're any closer to rethinking a paid sick leave program, or at least some sort of concession like what the NDP just brought up in terms of paid time away to vaccinate, something like that?
I think that there will be some type of concession in the budget later this month. I'm not sure what it'll look like, Adrian, but they have to do something for a couple of reasons. First of all, they have to stop the spread of COVID-19, and they are taking it seriously. I know it's fashionable to say that the government hasn't done enough, but they've actually done quite a lot. I mean, they're spending a fortune. And in Ontario, we've had some of the longest lockdowns in the world. You and I are in Toronto, where we still can't get a haircut.
And it's showing,
the barber stops
by the
and
way.
hair salons. It's showing on both of us. We're so handsome. But I think the thing is, if you're the Tories, you have to have something in the window to tackle this, because the NDP is gaining traction with this, the Liberals are gaining traction with this, and the Greens are gaining traction with this. So if I were them in the budget, I would probably put something in about giving people 3 hours off to go get vaccinated, especially when we're going to have this situation where the vaccines are going to be flowing really well in Ontario in the next couple of weeks. And if I were them, I want to do nothing to get in the way of people, leaving their shift for 3 hours at a warehouse or a factory to go get vaccinated and then coming back to work. So I would be surprised if they don't do something on that front. In terms of bolstering the federal paid sick leave, I don't know. I mean, there's still $700 million of that $1.1 million in the kitty, and around 245,000 Ontarians have applied for the federal program. So it is getting used, but it's just not being used as much as I think the federal government thought it would be, and certainly not as much as the provincial government would like it to be.
So, of course, again, the Ontario budget will be released at the end of March. It's always a matter of intense interest, but especially on this file, you're seeing reporters are really looking closely at what the finance minister will do in terms of paid sick leave that people have been talking about for a long time.
And the other thing to remember, Adrian, is they've booked a $38.5 billion deficit, which is the largest in Ontario history. They're going to spend more than $190 billion in this budget, also be the largest in Ontario history. And I think they really want to flood the zone with money. I mean, they're spending like money's just been discovered because they've already booked all this spending. So they're going to justify it. This week, we saw new money for homelessness that we didn't think would be in the budget. We've had new money for municipalities that we didn't think would be in the budget. They really want to get a lot of money out the door. So I won't be surprised if there is some kind of SOP to help people along the way through COVID-19 on this particular front. Now, whether it's bolstering the federal program, I don't know yet. But they are spending money, and they're spending lots and lots of money because they have it to spend. Next year will be a different story.
Rob, you know this better than probably anyone, that Queen's Park moves very quickly. But this story of paid sick leave, or the calls for it at least, from so many different fronts and different stakeholders, this has been a fight that the province has had to answer for months. Are you surprised by how long this has dragged on, or it has continuously come back for something that they have to answer for?
I think that the Tories underestimated the demand for this. And I think they also underestimated how difficult to navigate the federal program would be. I know that the Labour Minister, Monty McNaughton, was lobbying his federal counterpart. Premier Ford was lobbying Prime Minister Justin Trudeau to fix the program. So the federal government's answer to fixing the program was to create doubling the amount of eligibility, 4 weeks instead of 2 weeks. And this is just a one-time thing. It only goes till next year. So once the pandemic's over, this federal program will no longer exist. The Tories didn't recognize how much traction it would have. And I think the New Democrats and the Liberals and the Greens have been effective in keeping their feet to the fire. And frankly, news organizations like the Toronto Star, because we write a lot about it. In this day and age, there are more and more people in the so-called gig economy who don't have the kind of benefits that they can get paid sick leave automatically from their employer. And I think that's something that maybe the government didn't recognize.
And that there are so many people, again, who have been disproportionately affected by COVID that are part of this essential working force that, again, are not able to access paid sick leave in the same way.
Exactly. Folks who are working in lower wage jobs, in crowded settings, where they can't be 2 meters apart, or maybe the PPE that they're wearing isn't as good as it could be. And maybe they don't have employers who are as safety conscious as, our employers at the Star, which is why we're doing this not from One Young, but from our homes. It's paramount for the government to do something on this. I don't know what they're going to do, but the pressure is not going to dissipate. If there's nothing in the budget at the end of this month that addresses this, you can be sure that the New Democrats and the Liberals and the Greens will continue to put pressure on them. And we have an election in 2022, so it's only 15 months away. So this could be an issue into that.
Rob, thank you again for all your time and for your reporting on this and everything else going on at Queen's Park.
Great to see you, Adrian.
And that is Robert Benzie, the Toronto Star's Queen's Park Bureau Chief. Rob and the rest of the team at the provincial legislature will be tracking all the details of the budget set for March 24th. And you'll be able to find that coverage at the Toronto Star's website at thestar.com. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Mutar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.